black women are nearly 3 times more likely to die during or shortly after pregnancy than white women. And an independent review chaired by Baroness Amos is now examining how to address these disparities. Well, we can speak now to Sandra Igwe, who's founder of the Motherhood Group. Very good morning to you. Thanks so much for talking to us. I wonder if you can start by telling us a little bit about your own experience. I think you've got 3 children, if I'm right, but the birth of your second child was particularly difficult. Talk us through what happened, if you can.
Well, actually, the birth of all my children were quite difficult, but definitely after the birth of my second daughter did I start speaking up a lot more about the negligence that healthcare services share when it comes to Black women. I was dismissed several times. I was sent home several times. I was told that my pain wasn't, really painful because they were telling me that my cries didn't coincide with my contractions. And they also told me that I was over exaggerating, and no one in the hospital wanted to actually see me. There was a lack of compassion, and in such a vulnerable time of my life that I had to say, you're treating me this way because of the color of my skin. And that's when they started to take, sadly, my pain a lot more seriously.
Wow, so you had to actually tell them about themselves for them to take you seriously. I mean, we just had the government on here, Sandra, who said, sadly, this is something that's not new. She said that before she got into politics, she was working in charities. Decades we've known about this sort of thing. What's your sense when you speak to people? You advocate for more information around this. What's your sense when you speak to those who are making decisions as to how much they understand why this is happening?
I mean, the data has been consistent for years. I gave birth to my first daughter 10 years ago, and not much has dramatically changed. Families have been raising alarms for years. And when you see patterns repeat across the country, they're systemic and they're not really isolated. And so when you're hearing these experiences, you have to understand that yes, the NHS is, overworked, under-resourced, but there has to be, a commonality when it comes to why Black women are treated differently compared to our white counterparts. And you have to also see that compassion is inconsistent. When some staff are treating some women differently, you have to understand that actually it's their color and their race, their background, that is the main factor as to why their concerns are being dismissed. And we can see that women's voices are sadly downgraded instead of trusted in services. We have to see more lived experience at the forefront of reports and investigations and roundtables. We can't just look at policy level and not including, the experiences that Black women face every single day engaging with healthcare services.
And Sandra, again, in my conversation with Liz Kendall, she didn't actually want to use the word racism. Is that kind of part of the problem, do we think, that there isn't a desire to actually accept what really might be the cause of all of this?
Absolutely. I mean, without using the word or acknowledging racism, we're not really taking this entire investigation or the issues around Black maternal health serious. If we're seeing that Black women are 3 times more likely to die in pregnancy, our babies are more likely to have neonatal deaths and miscarriages and emergency C-sections and gestational diabetes, then of course we have to understand that race has everything to do with these poorer outcomes. If some mothers, Black mothers, are, on the receiving end of delayed responses, are not believed, are feeling invisible, and many mothers are saying that the trauma comes directly from how they're treated in healthcare services, and that directly impacts clinical outcomes, then yes, race and racism has everything to do with poor outcomes that Black mothers and families face in maternal care. So you cannot have this conversation without understanding or including the role of race, racism, microaggressions, misconceptions, preconceptions, stereotypes, harmful beliefs around the pain threshold of Black women and why we're not believed or our concerns are not taken seriously or there's not proactive care in our experiences as well.
And there is an independent review, as we were saying, being carried out by Baroness Amos, looking at maternity care, and they are going to look at inequalities as well. How much faith do you have in that? Do you hold out hope that that will change things?
I mean, families have seen many reports. I've been involved in many reports, roundtables, and investigations. And hope really comes when recommendations are finally turning into visible practice and when we can see change on the ground. And really, women will be the judge of whether this investigation is treated seriously or differently if we can see the disparities lower dramatically after the investigation, during the investigation. So I am hopeful, absolutely, but we need more professionals who are willing to listen and, you know, again, as I mentioned earlier, can see the correlation between race, racism and poor outcomes without saying actually race has nothing to do with it.
Okay. Sandra Igwe, founder of Motherhood Group. Thank you so much for joining us this morning and for advocating. We appreciate you being with us.
Thank you, Sandra.
Thank you.